Welcome back. We are here again with Navi, and we're going to be looking at the water element points, which is going to be your kidney and your bladder. So your kidney is the yin and the bladder is the yang. And we're also going to go over those shoe points that I've been showing you at the end of each video. And we'll start with the ting point for the kidney meridian, which is kidney 1. And that is, if you look at the big pad on the back of their foot, you go right into this hole and push right there, and that is kidney 1. So that's the ting point. Then we go to the inside of the leg from kidney 1. So there's kidney 1. Go up the inside of the leg, and right at the top of this hock, in this hole you fall into, big hole, that is kidney 3. That is the source point for the water element. Slightly 1 to 2 fingers width above that, in that webbing still, that is kidney 7. That is the tonification point. And then you go up, and at this bend of this leg, see how I bend her leg? In where it bends in the crease on the inside, that is kidney 10. An easier way to find it is if you bend their leg and you put your fingers there. There's a point on the outside, and then that kidney 10 is a point on the inside. You can almost pinch them together. And so it's hard to see like this, but when I bend it, you can see how it's inside in that, where that back leg bends. And that is the water point on the water element. And moving up, so that kidney meridian goes all the way across on their chest, and it ends right here in this kidney 27. The easiest way to find this, now I marked it since she was standing up, is to find the top of the sternum. So that's the top of the sternum. And then you push your fingers to either side, and there's little, almost ledges on either side of the sternum, which if you look at her face, she's like, that's really nice. That's kidney 27. So that's a great point for the lungs and the chest. And it's just another, helps open up that kidney meridian that goes all down the underside of the body. So now that we've done the kidneys, we're gonna look at the bladder meridian. And the first point we're gonna show you is bladder 10. And that is the test point for the opposite hind end. And you had, again, these points are not super perfect, but it's on the wing of that first cervical vertebrae, but on the muscle part. So it's hard to tell. Here's the divot for gallbladder 21, and then you go down, kind of diagonally down actually, and you'll feel this is the wing of that C1, and it's just right on top of it, on the muscle on top of it. So this is her top line, and there's gallbladder 20, and then it's down in there, right on top of that wing on the muscle, which she's like, I like that, thank you, Mom. Oh, okay, yeah. Good job. And that's going to test the other side hind. So not this side, the other side. And after bladder 10, we are going to come to these shoe points that we started talking about. So the first one you come to is bladder 13, which is the lung point. And that is going to be, I said, find the top of that scapular shoulder blade. And then here's her spine. And it's right in between the top of that scapula and the spine. The next one, you go down, there's usually like that makes it way easier, Navi. You go down over, there's like a muscle right there. And then on the other side of that, so that's also kind of going towards the outside edge of that shoulder blade, is gonna be your pericardium point. So it's gonna be bladder 14, and then you go a little bit down, only about a finger or so, depends on the size of the dog. And that is gonna be bladder 15, which is the heart point. So these are, if you look, this is actually kind of over the lungs, over the pericardium, over the heart. It's now we get to the liver points. This is when we start counting. So these are, you count 3. So it's 1 rib, 2 ribs, 3 ribs, and then follow it up. Now it's kind of moved. And that is going to be bladder 18, which is your liver point. The next one is going to be go 1 rib, 2 ribs, follow it up. Like I said, they're all moved because when she lays down 1 rib, 2 rib, follow it up, and that would be bladder 19, which should be the gallbladder. And then you have this last rib, which is the floating rib. And on either side of that, if you follow it up, is going to be bladder 20 and 21, and that's going to be 20 is your spleen, 21 is your stomach. The next point is going to be bladder 22, and the easiest way to find that is to go to the edge of the floating ribs and go straight up, and that is kidney 20 or bladder 23, which is the kidney point on that bladder meridian. And then if you've already found 21 and 23, it's midway between the two, and that is for the triple heater, and it's right over basically where the triple heater would be. And now here you have this is the tubercoxy, so it's that pointy part of the pelvis. Your point of hip is really up here, and then you have the pointy parts. So as you're going back, right before you hit that, you're gonna reach the large intestine point, and you'll feel it. And there is kind of a bigger gap because it goes bladder 23, bladder 25. So there is a bigger gap here. And then you go over that tubercoxy, and then you're gonna hit another point, and that is the small intestine point. And then lastly, you go down a little bit farther, and that is gonna be the bladder point on the bladder meridian, which is bladder 28. And she is out and snoring. And then the last, as we move back down this bladder meridian, which actually has a whole nother row that goes next to it, but we won't go into that now. So you go down here, and remember we had kidney 10 was on the inside of this leg, and bladder 40 is actually on the outside. So usually you do those together as a pair, and bladder 40 is the master point for the back and hindquarters. This is really great if they have any back or hind end issues. For her, they're great. She had actually had ACL surgery, and so she really enjoys a lot of that hind end support. And then you keep going down, and kidney 3 is on the inside, and on the outside is going to be bladder 60. That's also a good point for the back. And these are usually done together because it's kind of hard not to when you're just holding them. And then all the way down to that lateral edge of that 5th digit, and that is bladder 67. And that is where that ends. So you can kind of get a better view of all these points on her. And you can see all the colors of how they go down. It's not perfect, but it's pretty good. Thanks.